Brussels is the capital of the European Union and is the principal centre for international politics. Hosting principal EU institutions and the headquarters of NATO, the city is officially multilingual, speaking Dutch and French, but due to this, most people can speak English fluently as well. Its hospitals reflect its high standard of business strategy and forward thinking. Belgian companies have become international players in the medical centre, often acting as pioneers in medicine and offering a wide range of innovative solutions. Belgian hospitals are equipped with the most advanced technologies. They have the highest standards of hygiene and cleanliness. The risks of secondary infections are virtually eliminated. Belgium rates are less than 0.05%, and the average is around 10% elsewhere. Medical tourism is often hit hard by the press due to a lack of aftercare. However, we are the only medical tourism provider with our own clinics in the UK and Ireland, and the nurses and doctors that do your operation in Brussels can be seen in the UK when you travel back. This makes travelling to Belgium safer for patients, knowing that when they return home, they will still be looked after by our nurses and doctors.
Hi, my name is Frederick. I'm the patient care manager of Dr. Christian de Bruyn. Dr. Christian de Bruyn offers obesity surgery already for 17 years. In our hospital, we offer all types of obesity surgery: gastric banding, gastric sleeve, bypass and mini bypass surgery. The mini bypass surgery is a combination between sleeve surgery and gastric bypass surgery. With the mini bypass, we perform one anastomosis bypass. So we first make a small sleeve of your stomach and then 2 meters further we connect intestines to it. This type of surgery will give the advantage that people still are able to eat all types of food. So the quality of lifetime is much higher than with the normal or the full gastric bypass. Our goal is to offer a complete service. We guide you from start to finish, which means that we have clinics all over the UK, Ireland, Scotland. We have clinics in London, Birmingham, Cardiff, Manchester, Glasgow, Belfast and Dublin. Today I'm going to try to explain you a little bit more about this last surgery. We offer a complete service, which means that you can meet us in your own country to start. We do a pre-op consultation in our clinics in Manchester, London, Birmingham, Cardiff, Glasgow, Belfast or Dublin, wherever is the closest to your home. After your consultation with myself or with another obesity specialist from our team, you will fly over to Belgium. There, you will be picked up at the airport and transferred to the hotel where you meet me again. Then we give explanation about your surgery, and the next morning we meet you again in the hospital. In the hospital, we first take a blood example and an ECG to check everything is fine with your general condition. After that, you have your consultation with Dr. Chris himself. He will give you more explanation about the surgery and your life afterwards as well. After your consultation with Dr. Chris, we bring you to the OR. There you first have a chat with the anesthetics, and those guys place an infusion to put you on sleep. Then Dr. Chris will come in and he will perform your mini gastric bypass surgery by keyhole surgery. You're going to see myself as well because I'm assisting Dr. Chris. After your surgery, you stay for 2 hours in a special unit. It's called the recovery unit. There, doctors and nurses keep an eye on you for the first 2 hours after your surgery. After that, we bring you to your room. During your stay in the hospital, you receive all medications that are necessary for pain, for nausea, everything that you need. All our staffs in the hospital speak English. Not perfectly, but hopefully understandable, like myself. After the next morning, we take a new blood example and we take an ECG to make sure that everything is fine, that you didn't lose any blood or that you don't have any infections or things like that. We also make an X-ray to make sure that liquid can pass and that there is no leakage after your surgery. After the mini bypass, you stay for 2 nights in the hospital. After those 2 nights, we transfer you back to the Lodge Hotel, which is only walking distance away from the hotel. It's actually across the road. Your companion can stay in this hotel for 5 nights. Yourself staying 2 nights after the surgery as well in the Lodge Hotel, where we come to visit you each day to check everything is fine with you. In our hospital we perform the gastric sleeve surgery. With the gastric sleeve surgery you take 2/4 of your stomach away, throw it away, so you just make your stomach smaller. We also perform full gastric bypass and mini gastric bypass. The difference between those types of surgeries is that with the mini gastric bypass you make a combination between restriction and malabsorption. So you first make a small sleeve of your stomach and then you connect it with your intestines. This, with the full bypass, you only make a small pouch and then connect it straight away to your intestines. The difference between the 2 types of surgery is that with the mini gastric bypass, you will have a better quality of lifetime afterwards. You will be able to eat more types of food and a larger amount of food, but you will have better malabsorption. So weight loss wise, the mini bypass is as good as the full gastric bypass, but it's easier to perform. It's a one-anastomosis surgery which is completely reversible, which we think is quite... The biggest advantage for mini gastric bypass is that it's completely reversible. It's a one-anastomosis gastric bypass, so it's less riskful than the full gastric bypass. With the mini gastric bypass, you're able to eat more types of food compared to the bypass. With the bypass, if you eat sugar, there's more chance that you're going to have the dumping syndrome, which means due to the fact that the sugar is coming straight away into your intestines. Also, if you're going to eat fat, you're going to have more or quicker diarrhea with the bypass compared to the mini gastric bypass. So what we see is that the mini gastric bypass gives you a better quality of lifetime compared to the bypass, and that the weight loss is the same.